Okay, I know people will continue to trickle in, but let's get started. Thank you all for joining us today. Please introduce yourself in the chat so we know who's joining us. We are recording today's event, and the recording and the slides will be available probably by the end of the day tomorrow on our website, on our events page. I'm April Harrington. I'm the project manager of the Chicagoland Healthcare Workforce Collaborative. And today we are here for our fifth in our career pathway programs across the nation series. We're exploring nursing pathways in Vermont and North Carolina. For anyone who is new to CHWC, we are a group of employers and industry partners that have come together to support an inclusive healthcare workforce, provide accessibility for unemployed and underemployed populations, and develop innovative responses to the evolving needs of the healthcare industry. We're employer-led. These are some of the employers that sit at our table, but we're also supported by more than 20 strategic partners, including training providers, community organizations, funders, advocates, and others. Anyone who is interested in strengthening the healthcare workforce in Chicagoland is welcome to participate in our events and quarterly meetings. A couple of upcoming events to share. This first one, showcasing promising talent solutions, is not hosted by CHWC, but by some of our partners, by several partners, actually, Corporate Coalition, Healthcare Council of Chicago, Executive Club, and others. I'm putting a link in the chat. I think that this is their third or fourth year hosting this Showcasing Promising Talent Solutions event. It features several different employers and workforce providers. Their breakout sessions will focus on expanding talent pools, making skills-based hiring work, AI opportunities and risks, fair chance hiring, and apprenticeship models. It is free, so I hope to see you there on April 24th. And our next CHWC quarterly meeting is on June 3rd. That will be in person at Malcolm X Community College from 8:30 to 10 a.m. That entire meeting will focus on career pathways in healthcare related to today's event. And one of the main features of that quarterly meeting will be some research recently conducted by Women Employed. They interviewed 44 women who started their careers on the front line and have moved up in their careers in health. There are several themes that on the barriers they face and the drivers for career advancement that culminate in a whole suite of recommendations for employers, training providers, and other stakeholders. So we'll be getting into that in June. Like I mentioned, this is our fifth in our career pathway programs across the nation series. This is an effort to bring in different systems and stakeholders in other states who might be trying models and strategies that we are hoping to launch in Chicago, but might not be as robust here. We don't have any more planned for the time being, but I don't think this will be our last. And so without further ado, let's get to our topic today. We all, consistently talk about how can we invest in our employees' career advancement, help them move up in their careers, increase their earnings, while also building our nursing pipeline. We all are facing the same nursing shortage and thinking about how we can bring more talent into our nursing staff is something we talk about often. So today we'll learn about two programs who have some innovative solutions to these two issues. The University of Vermont Medical Center's licensed nursing assistant to associate's degree registered nurse pathway program, and then Advocate Health's RN educational assistance program. So I am going to turn it to our presenters today. They will share some short slide presentations, and then we'll move into questions. I have some prepared questions. I encourage you to drop your questions in the chat along the way, but we'll probably keep most of those for after our slide presentations. So I am going to stop sharing my screen and introduce Mary Ann Sheehan, the Chief Talent Officer at the Vermont Talent Pipeline, Vermont Business Roundtable, and Betsy Hassan, the Director of Nursing and Education and Professional Development at the University of Vermont Medical Center, to share their nursing assistant to RN pathway program.
Thank you, April. Really appreciate it. Can you guys see my screen okay? Okay, good. I'm Marianne Sheehan. I'm the Chief Talent Officer for Vermont Business Roundtable. We actually have a foundation that supports research and education, and we utilize a project called Talent Pipeline Management. I'm not sure how many people here have actually heard of Talent Pipeline Management, but it's a national framework that is employer-led. It represents authentic employer demand, and then we can bring that information to the education system to say, here's what we're looking for. Here's the number of people that we're expecting, who to hire in the next couple of years, and can you help us fill this pipeline? So we've been working on it for about 8 years. The talent pipeline management process is actually a process that was designed by the U.S. Chamber of Commerce Foundation. If anybody is interested in learning more about it, U.S. Chamber of Commerce Foundation has classes in it. So I'm actually one of the faculty for that. I'd also like to introduce my colleague, Betsy Hassan. And Betsy is someone who I've worked with for a number of years. Prior to her role at the University of Vermont Medical Center, she was the chief nursing officer at a regional hospital in Vermont called Rutland Regional. I'm going to mention a little bit about the state of Vermont, just so you guys have perspective. Our state is about 650,000 people, which is about the size of Indianapolis, Indiana. That's our whole state. We graduate about 5,200 high school graduates a year. We have a housing shortage. I don't know what it's like in Chicago, but we have trouble trying to move people here because we don't have any place for them to live. So a lot of our efforts are focused on how do we get Vermonters into these jobs from entry level to moving up. So I'm going to share a few slides. Betsy's going to share a few, and then we can hear from Chelsea and talk a little more about how this could work for you guys. Remember, it's only one way of doing it. I love this slide. It has really nothing to do with our actual presentation, but this is John. John is a person who worked for one of our hospitals, and he's a typical student. I'm just going to say we are not talking about people who are going into traditional education. We're talking about people who are going into careers after having worked on the front lines. So I love the way April teed up this discussion. I think it's going to be applicable to everybody, everybody who knows somebody. This was John's first day of school. His daughter made that sign for him and made him stand there because he used to do that for her. He's now an LPN. He's in his associate's degree program right now. So we always say, what are we trying to solve? If you don't know what your needs are, how do you know how to solve them, right? So we did some research, and we interviewed all of our healthcare collaborative in Vermont. Now we're talking about 54 different employers. Some of them are hospitals, some are primary care, others are residential care facilities, and some are visiting nurses. But what we came up with was our biggest demand was for registered nurses. We need about 1,200 a year, and we're only graduating about 400 in our state. Now, two of the programs that we have are state schools, and one is a private school. So when we ask how many people are going to stay here of that 400, I'm going to guess it's something less, right? So we said, even if they all stayed, which they won't, because they can't find any place to live, right? Unless they already live here. We have a gap of about 800 registered nurses every year. So how can we fill that? Well, two things. We can increase our educational capacity and we can reduce our attrition and retirement number. Um, Really, those are our two biggest ways to do this. So when we do the research, we ask people why people are leaving. Is it because of attrition or is it because of retirements or promotions or different things? So we can actually like see what those numbers look like. It sounds like, a huge effort to do this, but when you actually bring this to an employer group and ask them these questions, most of them don't know. And so asking them to reflect on what their needs are really puts them in a good place to put together a plan for their supply. How are we going to supply our own people? So this is what our nursing career ladder looks like. And I'm just going to say the things in this first row that are kind of reddish all represent sort of entry level roles that might start into a nursing pathway. There are so many others. I'm just going to say, for instance, Betsy's hospital, UVM Medical Center, has a real strong need for licensed nurse assistants. So they want people to be licensed nurse assistants in order to go into their program. Other hospitals are smaller and they say, well, we can't take all of our licensed nurse assistants and get rid of them. We are going to take anybody who's qualified. So we have a pre-qualification process, but you could work in food service, you could work in human resources, you can work in any department that, as long as you're qualified to go into the nursing program, we will take you. And that gives them a better distribution of like who can actually attend the classes. But the purpose of this pipeline diagram is just to show you like on average, and these wages are 2023. So I'm going to say they're almost 2 years old. They come out every May and they're already a year old. So this number is probably more like $23 an hour. But when we did this work, it was $20 an hour for a licensed nurse assistant. And with these credits and this 1 year certificate program, the average rate of pay was $31 an hour. So that's pretty significant. And then with an additional year of education, you could be making $42 an hour. So that's like sort of the story that we're trying to build, which is if you have a list of positions that you want to recruit for, those are really good starting places for people to go into so that they can move up in their career. So I like to point out this diagram here in green. You have to have a master's degree in order to be a clinical nurse educator, but this is our pain point. This is where we all, struggle because we don't have enough of these in order to meet the demand for the number of students who are interested in the program. When we talked about the numbers of people in registered nurse programs, 400 a year, about 50% of the people who apply for those programs are qualified and can't get in because of limitations in our education system. So it's, there's a whole demand here. But in our pipeline, we are thinking constantly about how to move people into the practical nurse, into the registered nurse, and then also consideration of how to get more people in the master's program so that they can teach. So now Betsy's going to talk about why it is sustainable.
Thanks, Marianne. Hi, everyone. I'm Betsy Hassan. I'm the Director of Nursing Education and Professional Development at the University of Vermont Medical Center. We're about a 500-bed academic teaching facility that's also the flagship of the University of Vermont Health Network. The other hospitals that are within our network are community-based organizations that are about 100 beds or even critical access hospitals. So we really vary throughout our sizes in our network. And that's really similar to the state as well. We're the only tertiary care facility in the state. And then there's 11 other hospitals that are more critical access and smaller. And so Marianne and her partnership with other employers really sees the scale of what organizations need based on their size. So we served as the pilot site for implementing this framework, and it has been an iterative process that we have learned a lot from over the years. But really, when we think about sustainability and how we invest in this program and this structure in the long term, there are four key components. One is that we, as part of the program, provide practicing clinical instructors. We do that through a dual service agreement with the academic employer. How this benefits the actual person serving in that role is that they maintain their higher rate of pay with us at the organization, and we release them for the hours that they serve as clinical faculty. So they're not working overtime and taking on this role. It's part of their normal work week. They're getting paid what they would get paid if they were at the bedside, which is always higher than what our clinical faculty get paid. And then the academic partner reimburses us at that lower rate for their time that they're serving. And so really what we're investing is just the delta between those two pay scales. This also helps build stability into the program, the academic programs. So as we're asking to either increase their admissions to support one of our cohorts, we're providing that clinical faculty need. We also have significant wraparound supports for our students and employees. So this is things that are within the walls of the organization, such as our Employee and Family Assistance Program. We have designated funds called the Leroyer Fund, which is really about if someone has a one-time heating need or that their car broke down and they don't have the funds to pay for it, we can use those funds. We also work with a program called Working Bridges, which also looks throughout the community for additional supports that can help people financially or in other ways. And then we also provide things like paid tutoring or helping to support people get laptops if it's not included or if they don't have one at home so that they can be successful. We also have academic and financial advisors that work directly with our students in our cohort. And so they know the academic programs really well. They know available state and other funding that can be available to these students to help reduce the amount of tuition. We also work with an employment agreement. So for every student that gets accepted into our program and is supported for the 3 years of schooling, meaning their prerequisite year, their LPN certificate year, and then their associate's degree year, we ask for 3 years of service in return. And that's here in an RN position at the hospital. And then the last piece is we have a recycled education financing loan program. And so this is an employer-funded loan that the organization seeds the loan amount that gets dispersed directly to the student in their name. And then as long as they're completing that employment agreement and having good standing within their programs, I immediately pay those loans on a monthly basis back into the fund. And so we're constantly replenishing the fund that we're investing in. And it will eventually become a self-funded loan that we don't necessarily have to put more dollars into. We're in the 4th year of doing that. And so I think at year 5 is when we stop having to really feed the loan larger amounts. You can go to the next slide, Marianne.
Sure.
So this is a visual representation of all of those elements as a person would go through this program. The top bar is really talking about their employment. So we have them coming in. They either have to be a licensed nursing assistant or they're eligible to become one. So we have a nurse assistant training program in our facility. So that can be an earlier component of the pathway program as well, getting someone into that training program. It's about 5 weeks long, and then having them start in an LNA role as they enter the nursing pathway program. In that 1st and 2nd year, when they're doing their prerequisites and participating in the LPN certificate year, they're working as an LNA with us. They are also able to get release time. So they maintain their full-time status. So they maintain benefits and all of those perks of being a full-time employee with us, but they get released for 12 to 24 hours based on which academic year they're in to be successful in the coursework and to participate in things like clinicals. In year 3, they've obtained their LPN certificate. If there is an LPN position that's available to them, they absolutely can go into that role and start earning that higher wage. We do have many that continue on in the LNA role because they want to stay on their home unit. We don't have as many LPNs within the acute care setting as previously. And so that for us, that's sort of it's an optional piece of our pathway. And then after they graduate from their ADN year, they're then working with us for those next 3 years in a registered nurse capacity. How this works in terms of their education, those two are sort of drawn out over the course of 3 years. So their LNA doing their prerequisite or health science courses, their LPN year, and then their ADN year. And then to visualize the loan repayment, we start paying for those prerequisite courses, and they take out a personal loan or not a person, employer-funded loan with us in their name. And then within 30 days of that disbursement, I start making those payments on their behalf as they are progressing through the program. When they get to the next academic year and they need their LPN tuition, they again work with our financial counselors to reduce the amount of tuition costs as much as possible, and then take out a second loan. So during that year 2, I start paying down 2 of their loans on a monthly basis for them. And then it's the same for that 3rd year as they go into the ADN program. And those loans all get paid off in total over a 6-year time period.
So I'd like to add to that. One of the benefits of this is if they end up leaving, they take their loan with them.
Mhm.
If they stay, the loan gets repaid by this employer.
Yes, thank you, Marianne. So that is one of the easier processes. Sometimes people are looking to, claw back money should someone not fulfill an employment agreement or those types of things. This is a really easy way that if someone were to leave during that repayment period, I just notify our financial partner and the invoices start going to the individual as opposed to us as the organization. So really looking at, how in the long run is this really worth it? There are a few key pieces of financing that we look at. One is looking at how much it actually costs to educate a staff member into becoming an associate's degree nurse. If there's no financial aid associated with any of these, or they don't receive any scholarships or grants, it's approximately $47,000. So this primarily, we do have a very expensive academic partner, one of the more expensive state universities, but that usually equates to about $30,000 in what we're actually paying in tuition costs. And then when you think about paid release time over the course of this period, it's about $13,000. And then really looking at, wraparound support costs, potentially paying for tutors and things like that, it's about $2,500. And then any sort of administrative costs is about $2,000. Here in Vermont, when we look at filling a contracted position for an RN, we're really looking at about $250,000. So this really is a cost-effective way if we're even just replacing one for one in reducing our reliance on contingency staff. So it really is not, how can we afford to do it? It's how can we not afford to do it? We really have within our network, we have a number of pathway programs that we're really seeing how great it is to invest in our current workforce who's already here, established in the community, has housing, has that loyalty to the organization as well. And so that's what we've really learned. We've applied the same type of framework to developing a MSN or a Master's in Nursing pathway program as well. And in terms of their service repayment, they're actually working as clinical faculty for a 2-year period to also help stabilize our academic partners. So, once you build a program like this, you can also look to see how else it can be applied in other ways with different roles or different professions. These are on the left-hand side, you'll see our resources or our partners in all of this work. And then these are all of the participating hospitals and organizations that are now using this framework and a part of our healthcare collaborative. Did I miss anything, Marianne?
You did a great job. We're actually considering some of the other positions that are really high demand that are technologist roles, like surgical technologist, lab technologist, radiology technician, trying to think of what some of the other ones are, respiratory therapist. So we're looking at how we can build some pathways like that as well. All right.
Thank you so much, Marianne and Betsy. Such a fantastic model, particularly the dual service agreement with the clinical instructors, I think is something that I've heard us talk about here. And the loan repayment model as opposed to a clawback. Very fascinating. I encourage everyone, if you have questions, put those in the chat. We're going to get to those after our second presentation. So let me introduce Chelsea Rigler, who is the Director of Workforce Initiatives and Grants at Advocate, formerly a part of Atrium in North Carolina. Go ahead.
Thank you so much, April. And let me see if I can go ahead and share my screen. I am not used to Zoom. I am an everyday Teams person, so y'all bear with me for just a second. Okay. Did I share it? No.
Not yet. Take your time. It's like we all kind of speak different languages. There we go.
There we go. Okay, perfect.
There you go.
Thank you so much, April. Hi, everyone, and thank you so much for the opportunity to be here today. My name is Chelsea Rigler. I'm the Director of Workforce Initiatives and Grants with Advocate Health. So I thought it would be helpful to start out with who we are, because that's definitely a question that comes up. So Advocate Health is the third largest nonprofit integrated health system in the United States, which was created from the combination of Advocate Aurora Health and Atrium Health. So we provide care under the names of Advocate Healthcare in Illinois, Atrium Health in the Carolinas, Georgia, and Alabama, and then Aurora Healthcare in Wisconsin. So as an organization, we employ nearly 150,000 teammates across 69 hospitals, over 1,000 care locations, and more than 21,000 physicians, 42,000 nurses, and serving nearly 6 million patients. So we have a very wide footprint, which really gives us the opportunity just within our own organization to share amongst all of our care locations. So today I'm really excited to get the opportunity to share with you about our RN Educational Assistance Program that is very close to our hearts. It's one that's helping us meet our critical nursing needs while also creating real opportunities for our frontline teammates. So as Marianne and Betsy already talked about, we know that many of our teammates are passionate about becoming nurses, but balancing work and life and school and all of it can often feel impossible. So the goal of our RN Educational Assistance Program is really designed to change that, to remove barriers, offer support, and open up a path that works for working adults. So I'm going to walk you a little bit through about how the program works, some of the supports that we've built in, and some of the things that we've learned along the way. So The program really was designed with two core priorities in mind. First, we wanted to create meaningful internal mobility for our frontline teammates, particularly for this program, those who are earning $55,000 or less annually. And then second, the program itself directly supports our organizational need to grow and sustain a strong pipeline of registered nurses. So by focusing on teammates who are already pursuing an ADN or BSN degree, we're investing in talent that's already committed to the nursing field and to our organization, which really for us creates a win-win approach for both the individual's career and our organizational strength. So one of the biggest supports that we offer through this program is the financial support. Each participant receives up to 3 years of prepaid tuition, books, and fees with a maximum of $14,000 per year. And I did want to emphasize that's not like traditional tuition reimbursement. It is upfront coverage, which really helps our teammates with reducing the financial burden from day one. We include in that tuition, books, any program specific fees that are all covered directly as long as the participants remain in good standing and continue progressing through their nursing program. As each participant approaches graduation, about 6 months out or so, they will become eligible to apply for a role in our new graduate RN residency program, which offers them structured support and onboarding in one of several specialty tracks. And then finally, upon licensure, we do ask that participants commit to at least 4 consecutive years of employment in an RN role within our organization. So truly, it's a full circle model where we're investing in their future and they grow their careers right here with us. One of the most impactful components of this program is the flexibility that we provide around scheduling. So we understand, of course, how demanding nursing school can be, especially for teammates who are juggling coursework, clinical hours, and of course, many of them family and financial responsibilities as well. So through this program, full-time and part-time teammates can reduce their working hours to dedicate time to their education, all while maintaining their pay and benefits. And this really helps relieve some of their financial and time-related stress that they might otherwise face. So we've accounted for operational continuity through our resource team by providing support to backfill staffing needs. So that way departments are not negatively impacted when participants in this program are taking advantage of their education time. To make sure that the program is working smoothly for both the students and the departments, we've built in a few key guidelines. So firstly, we recognize that BSN students often have more flexibility since many of their courses are online. And so their education time may look a little bit differently than our ADN students who have a lot more in-person classes and clinicals. And also education time isn't just for while they're in class, they can use it for studying as well. So that said, though, participants do have to be transparent about their schedules, communicating it with their leaders every semester. And then we also ensure our labor management team is kept in the loop annually. And as I mentioned, we offer the resource team staffing if needed to make sure that the department maintains productivity as well. So support resources that we provide for the program, we know that financial support and schedule flexibility alone aren't always enough to ensure success. So we've layered in several types of other support to walk alongside participants from the time that they enroll all the way through to their NCLEX completion. So every participant is required to engage in monthly sessions with a career life coach, as we call it, to help them stay on track, manage their stress, balance their competing priorities. We do also strongly encourage them to meet with their college academic advisor, not just before enrollment, but also throughout their journey to make sure that they're mapping out a realistic academic path that they're going to be able to complete. Additional resources that we provide, of course, include a participant guide, and then we have an internal employee assistance and help now program that provides even more assistance to teammates, ensuring that they feel supported every step of the way. This holistic support structure really helps to increase the likelihood of both their academic success and long-term retention with our organization. So I did want to briefly touch just a little bit on some of the success we've had with our program so far. So since launching the program in 2018, we've had 157 teammates participate. So this speaks not just to the demand, but also the trust that our teammates have in this pathway. Every year we get hundreds of applications and unfortunately are only able to select a small group, but it is definitely a widely popular program for our teammates. So far, 38 of those participants have successfully completed their degrees, so either an ADN or BSN degree, and transitioned into RN roles within our system. So really that's not just a number, it's 38 individuals who have advanced their careers, often from frontline positions, and are now providing care to our patients in a whole new capacity. And what we're especially proud of is our 93% retention rate among participants. So that tells us that our support structure is working. Our teammates feel valued. They're staying with us. They're growing right here within the organization. And we're often seeing most of those participants come back and continue their educational journey, whether it's through specialty certifications or continuing advanced degrees. So in conclusion, I just want to say we created this program not just to meet our workforce needs, but to invest in people who are already making our organization what it is, our frontline teammates. For many of them, becoming a nurse was a long time dream that often felt out of reach while working and supporting a family. So by being able to offer them time and support, we're really saying that we believe in you and we're going to help you get there. And what we've seen is that when you remove the barriers and give our teammates the right tools and flexibility, that they rise to the challenge, and the organization is what benefits in the end, and so does patient care. So I think that is all I have. I will hand it back to you, April, as soon as I figure out how to stop sharing my screen.
Take your time, Chelsea. Thank you so much. That was fantastic. I'm going to take a couple of the questions in the chat, and then I have a few prepared questions, but people can put questions in the chat at any time. First, let's go back to you, Betsy. Can you share a little bit more about the employer loan program, where those funds are coming from, the administration approach, the average loan amount, and also how you secured buy-in from various stakeholders for this financial approach?
Yeah, and I will lean on Marianne as well, because this was part of her early development work with our financial assistance partner. So we partner with the Vermont Student Assistance Corporation in this work, and it really is about we have existing tuition reimbursement models with loan programs. And so that is where an individual takes out 3 large loans over the course of time, and they're paid off in bulk at once over the course of 3 years. So this took a little bit different of an approach in the sense that a student works with our financial partner. They go through the FAFSA process and reducing any tuition amount that we can through state and federal aid. And at that point, that bottom line tuition dollar is then pulled together for the cohort in and of itself. So for each 10 batches of students we have. Then VSAC invoices me for that total amount to fund the loan for their academic year. So I pay that out of my operational budget because I am actually budgeting for almost the full cost of tuition for each of the years of school and the number of students we have in each year. And then those loans get dispersed to the academic partner under each of the students. And then within 30 days, I start receiving invoices from VSAC that a loan payment is due. And so I'm paying it off on a monthly basis. And we really have a very low interest rate in working with them as our partner. And so it really is a cost-effective way to manage the loan. it also should get to a point at year 5-ish that I no longer have to seed the loan with that money because of what I've repaid back into it through covering those loan payments. And so eventually we will have to stop the budgeting component of those large dollar amounts on an annual basis. Now that would change if we decided to increase, student numbers. I would then probably have to add some additional seed funding to support those. But eventually it should just fund itself with those monthly payments. And as Marianne said, that if someone should leave the organization and not complete their service agreement, then they actually continue to pay into that same fund. They're just doing it as an individual as opposed to myself.
Thank you, Betsy. Marianne,
So
yeah.
what Betsy is describing is basically you're reseeding the loan each year, and by the time 4 years goes by, your payments end up being just the monthly payments. So you don't have the upfront payment. So that's the sustainability portion of this. And some of the hospitals that we worked with applied for a grant, a nursing apprenticeship pipeline grant, which was offered by our state to get it off the ground. That really helped. I mean, we can talk till we're red in the face about return on investment, but still that's hard for hospitals because a lot of our hospitals are operating on the edge of profitability, and some of them not profitable. So if you don't have any money to invest, it makes it a harder nut to crack. But having, some sort of seed funding, even if it's a small amount, to get an administrative person who's responsible. We typically put together a we call it a program charter, which says, for their leadership team, their chief nursing officer and the CEO of the hospital would sign this to say, yes, this is what we want to do. We have shared, vision of what we're trying to accomplish here. So we agree that we want to partner with you.
Also for us, each employee does have, based on their years of service, allocated tuition reimbursement dollars that are budgeted on an annual basis. And that is, those funds are included in sort of the payment model. So if a student is in the pathway program, their tuition reimbursement also comes into as a mechanism to support that operational budget as well.
Right. It's repurposing that money. Yep.
It's a really interesting model. Thank you for sharing. Chelsea, can I ask you how you determine how many teammates can participate in the RN Educational Assistant program, and how do you recruit them?
Yes, absolutely. So we started out back in 2018 with cohort. I think the first one was like 5, and then we gradually went up from there, up to we got to a point of about 15 in 2021. In 2022, we did apply for and receive some grant funding to be able to increase our cohort size. So last year, we were able to, with help of grant funding, select 50 teammates to participate in the program. We are currently having conversations about how to maintain sustainability of an appropriate number going forward. So it will likely go to more of like a 30-ish teammate per year number that we will look at per year of the number of teammates that we can accept into the program. They do, for a portion of it, of course, use their employee benefit, and then the rest of it is additional money that our tuition budget accounts for the additional money up to the $14,000. How we recruit and select participants. So a lot of our recruitment is on our internal, what we call People Connect pages. So it is kind of broadly sent out to teammates. It started out as just a CNA to RN program and then evolved from there because we, of course, had a lot of other teammates not in CNA positions who were very interested in applying. So I would say our recruitment has kind of scaled because it started out as just recruiting to CNAs, and then we moved into anyone who's interested in applying can apply as long as they are accepted into a nursing program. We do have a very, I will say, rigorous application process that they have to complete in order to participate. So it includes recommendations, peer recommendations, leader recommendations. They have to complete an essay. So there's a lot of different requirements that go into them. Not just applying for the program, but being accepted as a participant in the program. I would say, though, at this point, because of the popularity that we have with the program, our our marketing and recruitment efforts have definitely had to scale back because we can only select so many per year, and it's already so popular that teammates know about it and they wait for it. And we're getting questions. It doesn't launch until May, and we are already getting inundated with questions about people like, when does it open up? What day is it going to open up? So hopefully that answers the question.
Got it. And thank you for sharing a little bit about your screening process. I wonder if Betsy and Marianne, if you can share a little bit about your selection process. And, to Chelsea's point, it's a rigorous education experience to become an RN. What do you do to help employees become school ready and then persist through the program and that academic rigor?
Yeah. So we also have an application process. First, what we do is we actually hold info sessions for our program. We try and have them span all 3 different shifts, so we can make sure we're meeting the employees' needs. But in that info session, we talk about the requirements of the program, that the eligibility to continue on into the nursing program is, something that is looked at through an academic lens. And so we work with our community college partner to have them go through first an academic review with our academic counselor, seeing maybe what they've done in the past for coursework. They have some testing that they have to do. They also meet with our financial counselors as well in that early part so that they understand what risk they may be taking on if they're not successful in the program. And then we also have an interview and, essay process that they complete. And then to ensure that when we have the right candidates who we have looked at sort of with that really broad, comprehensive lens, selecting those candidates that we feel are going to be the most successful throughout the program. In terms of once they're in the program, what we have for supports for them are one, early access to tutors, like one-on-one tutoring, as opposed to, tutor.com or something else that may be available through the school. We also have had some students who English is not their first language. And so we've supported them with some additional supports in terms of either tutoring or just learning how to study for nursing and things like that. And then we also partner directly and I meet every other week with the academic partner and our financial partner to make sure that I'm keeping a status on all of the students and that they're doing well. If there is something coming up within their life that's impacting their academics, how I can be supportive. And then we also work with the managers directly of these staff to ensure that their schedules reflect that paid study time, as well as that they're managing that clinical or class schedule with an appropriate schedule.
That requires a FERPA from the
Yes.
employee, employer, and school.
Got it. Speaking of that, I'd love to talk a little bit more about your collaboration with training providers. How have you collaborated with your training providers to ensure participant success? And have they made any policy or practice changes to make their programs more accessible for your employees? And also still what remains still challenging about working with training providers. Who wants to jump in? It's Chelsea.
Jesse will start, and I
Go
will
ahead.
finish that sentence.
All right, so this is the only program that's available in the state that will achieve an associate's degree. And so it is that 1+1 model with the LPN certificate. That LPN year is really a lot of work, and not all of those credits and clinical time actually count towards their associate degree year. So there is some duplicative practices and time that these students have to put in. So I would say that that is probably our biggest challenge, is sort of recognizing that the program doesn't necessarily meet our full need, as well as the expense associated with it, just because that LPN year is also, it's 3 semesters as opposed to 2. And so there's additional tuition costs that are related to that. So I think, and we're also in that year having to invest more study time. So during that LPN year, it's only really feasible for these students to be working 1 12-hour shift per week as opposed to the 2. So we're investing more in that paid study time as well. I will say the quality of the program is really great. The nurses that are coming out of the program are exceptional, and they have a lot of support from their faculty. But I would say, if there was another option within the state that was just a straight 2-year program, that we would definitely be leaning more on that than this 1+1 model. Marianne, I don't know if you have other examples from folks.
I was going to say, if we could get even an education provider who is not in the state, it's probably cheaper than ours. But I think one of the things that Betsy's talking about is really time efficiency, cost, things like that. There's a lot of pieces that go into it, but it is the only one in our state that offers that. So that's what we have, and that's what we're using. And LPNs are hard to use in the hospital setting. So, and then on the flip side of that, we work with residential care facilities whose most of their traveler budget is on LPNs, but that's not how it's working out. So if there was a way to wave a wand and get some success in that education side, it would be pretty cool. But we're just, going through the normal steps, which I think is like a really kind of 18 months to 2 years before you can see some success in that.
So I will say we have, I think, with our program, the opposite problem, and I kind of want to scale back a little. So a requirement for the program is really just to have a full acceptance into a nursing program at an accredited school. So we're not necessarily saying they have to go, to a certain school or not. It's really up to the teammate and, as a student to select where they want to go. One thing we are intentional about is making sure that if they're accepted, that the school is able to accept our letter of credit with our educational assistance provider, because that allows that prepaid model to really function the way that it should. That being said, I would love to see us have a little bit more thought process around preferred partners. So one of the things I mentioned at the top of my presentation was, as an organization that's recently come together of kind of 2 different systems, we're looking at historically what each of us have done in the educational assistance space, and our partners in Illinois and Wisconsin have what's called a preferred nursing partner program, where they have selected a group of nursing schools that they partner with and encourage teammates to go, and there's a higher educational assistance dollar amount they can use with them. And I would love to see us move towards that model, specifically with this program. I think it would give us a little bit more control over where they're going, and not, very much so, I will say, appreciate diversity of thought, but sometimes the $14,000 goes further in some places more so than others. And I say that with saying we at Atrium Health have two colleges where I would say that $14,000 probably wouldn't go as far as it should. So I say that in full transparency to say that our own colleges are probably some of the most expensive. But, my point with it was really just to say I think I would love to see us, instead of them being able to go anywhere, maybe put a little bit of framework around what schools that were encouraged them to go to.
I was going to mention also that Betsy talked about quality. So the quality of the program is extremely high in our setting. And I put in the chat 100% pass rate for the PN program, for the NCLEX, and 95 for the RN associate's degree, which is better than some of the bachelor's programs out there. So, it's a really strong program, if not for, all those things. So yeah, but I get what you're saying, Chelsea. It's like you can always come up with continuous improvement suggestions, but how they're picked up and implemented is another piece. So
Thank you all. I know we are almost at time, so I want to ask one final question. If each of the three of you could just say in a couple of words what you think the most important aspects of your program are to ensure participant success. Allow them to, tend to all of their other life needs, their families, be able to continue working and make it through. What is the most important participant success supports? Betsy, you want to go to you first?
Yeah. So I would say that it is that paid release time, allowing them to have the time to dedicate to the coursework, that's not in addition to their full-time job. And then I would also say the tuition funding. I think that for a lot of people that I work with, this is a life changer, that there's a program like this, because they wouldn't be able to afford going to school without it. And so those, I think, are the two key aspects that I would highlight.
I think that what Betsy, what she's like getting at kind of is there's really no out-of-pocket expense for the individual. Like they get to maintain their role, they get their education, and they get advancement while they're working without having any out-of-pocket. Like that loan repayment includes books and tests and, supplies and things like that. That's all built into so they don't have any expenses, which they wouldn't otherwise get to do it.
I would also say that one sort of unintended benefit of this program that we didn't realize when we built it was that because I'm making those loan payments on their behalf, we're actually improving some folks' credit. So for those employees that maybe had a previous credit history where they probably wouldn't even be able to get a personal loan to go to school, we're actually helping them to build some economic freedom as well. So that was one thing we didn't think of when we thought of making loan payments.
Chelsea.
I love that. I know one word, right? I would echo it. It's the paid education time. It's really what makes a difference. They're able to maintain their salary and their benefits, and while having time to study, to complete coursework, to complete their education. It's a unparalleled benefit that I think you just can't put a dollar amount on. It's amazing.
Amazing. Thank you all so much. Thank you, Chelsea, Betsy, Mary Ann, for sharing your programs with us. We're a small but mighty group today. It's the middle of spring break, but I've been getting some direct chats about, oh, we should do this with this partner in Chicago. So I'm very hopeful that you all on the call in Chicagoland will help me bring these strategies to life here. Thank you all. Enjoy the rest of your Thursday. This recording and slides will be available on the website tomorrow. And I hope to see you all in Chicago at our June quarterly meeting. Thank you.
Thank you.
Thank you to our presenters. Have a good day.